Let's talk about LASIK surgery. What is it, and who is it for, and who is it not for?
Well, LASIK surgery is a very simple thing. You're taking someone's glasses, making the calculation, and putting it inside their eyes. So the biggest lens in your eye, the biggest refractive surface on your eye is the cornea, which is the like the glass of your watch. It's the outer surface, the anterior transparent outer surface of your eye. We take this surface and we change its power by laser, by ablation, and reform it so it would correct your vision so you don't need more glasses. In LASIK, we remove a very thin layer of the cornea, pick it up, and then do our ablation, change the power of the surface of that cornea, and then put back again that flap, put it back in its place, and it adheres back in its place again within a few hours.
And how long does the recovery usually take?
For LASIK, by the next day, usually you're fine. You can see a little bit blurry. By the end of the week, you're seeing absolutely fine.
Are there any precautions that patients need to be aware of before or after the surgery?
After the surgery, you should not rub your eyes. Don't do that for at least 1 week. Do not touch your eyes or rub your eyes. Before the surgery, please, for 2 weeks, do not put on contact lenses.
I was also told not to put makeup on.
Don't put makeup after the surgery,
Yes.
so you wouldn't get any of that makeup like sliding under the flap or something.
And what is the difference between LASIK and femto-LASIK?
It's how we elevate that thin layer. With femto-LASIK, it's assisted by femto-LASIK. With LASIK, it's done by a microkeratome. It's a mechanical removal, and you need to do femto-LASIK when you need a very thin flap, or when you're worried about the patient because it has a better coaptation, like a more advanced coaptation on the cornea. So if you're suspecting that your patient is more of the person that could have a dislocated flap or something, you opt to going to femto.
If you can afford femto-LASIK, just have femto-LASIK. Would you think this is true, or does it depend on every case?
Well, it's kind of true because femto-LASIK is more reproducible, the flaps. It's more reproducible. You don't need it, but you can have it. It's an extra precaution. If you don't need it, you shouldn't be advised to do it, but you can do it. Yes, it's more safe. It's more neat, much nicer. But concerning vision, there's no difference because the ablation is the same. It's how you elevate the flap and how the flap collapses on the bed again. But the ablation of the bed is the same in both. Once you elevate the flap, the ablation is the same.
They seem pretty similar now.
They are, but the safety profile in the femto is a little bit higher. I use the SBK technique in LASIK, and that was comparable in a lot of studies. It was very comparable to femto.
And how soon should a patient expect to see improvement in their eye vision?
The next day, they will see very well. By 1 week, they will see perfectly fine. By 1 month, this will be the perfect vision they will see. By 6 months, they will have no problems with glare or anything. They will be absolutely fine.
So there is a bit of sensitivity to light and glare immediately after?
The first few days. The first couple of days, yes.
Would a person who had LASIK surgery ever need repeat operation?
Some patients do. Yeah, some patients do. This is very rare, but it happens if you need a redo, and you do it like in a few months if you need the redo, but that's very rare.
Why would you need a redo? Is it possible because you've done the surgery when you were too young? Or is this not?
We shouldn't do the surgery for someone whose vision is changing. If your glass prescription is changing, we should avoid doing LASIK until the prescription is steady for at least 2 years. And you should be over 18 or 19 years old.
Is it not more risky to do a reoperation of LASIK?
Well, we try to avoid it as much as possible. It's not risky, but we try to avoid it. So we do our full correction from the very beginning.
You mentioned astigmatism earlier. What is it? And is it treated by LASIK surgery, or is there other ways that you can treat astigmatism?
Well, astigmatism is a form of sight problems. You need glasses to correct astigmatism. You need contact lenses, and you can correct it with the LASIK surgery. And usually everybody has a sort of astigmatism in their eyes. Astigmatism is when your whole system of your eye does not have a single focus to put on the retina of your eye. It has a system of two lines, conoid term. It's a complicated thing, but it's something that can be corrected by LASIK and can be corrected by glasses and can be corrected by contact lenses.
And does it tend to come back after LASIK surgery?
No.
It doesn't.
Once properly corrected, it doesn't come back. Unless you are having a problem. You were not evaluated properly before the surgery. You are not a good candidate. And you skipped evaluations for the corneal thickness, the corneal topography, the things that we have to be very strict about to do before the surgery.
What would make a candidate unsuitable for LASIK surgery?
For example, if their corneas are too thin, if their corneal tissues are weak, and they have a keratoconus or something, or if they have any pathology in their corneas.
So you need to have perfect corneas for LASIK surgery?
You need to have a perfect evaluation of your cornea.
Does LASIK surgery have any complications?
Well, usually LASIK surgery is a very simple surgery too. It has very limited number of complications. The more usual complication is flap displacement, which happens if the patient does not follow instructions and rub their eyes early, or if the patient receives a minor trauma after their surgery at the very beginning of the post-operative period, or if they get an aggressive trauma a few months after the surgery. So if you're a combat fighter, we don't advise LASIK for you. If you do contact sports, we advise different techniques of vision correction for you.
Other than LASIK surgery.
Other than LASIK, yeah.
Is it permanent?
Yes.
What are the other methods of correcting?
Well, there's a lot of refractive surgeries. The most simple one that are similar to LASIK is the PRK, which is a LASIK on the surface of the cornea without a flap, the elevation of a flap. And this conserves more corneal tissue, and it gives a cornea that looks absolutely like a normal cornea and would have very few complications.
And does it fully correct vision?
It depends on the error. With LASIK, you can correct more, but with PRK, you can preserve more tissue. So if the cornea is a little bit thinner, you can go to PRK, or if you're involved into, as I said, anything that has combat or something like that, you go for PRK.
It just sounds very interesting, PRK, because it sounds like it achieves the same result or a very similar result with less risk.
Yes, but the trick is LASIK, the next day you're ambulant and walking in the streets. PRK, you're 1 week at home, burning eyes. First 2 days could be very painful. So that's why some patients don't like it. But eventually, after 6 months, they're both identical. But PRK provides a stronger cornea and a more free life.